Chapter, and everybody said our ideas are crazy and wild and extreme. And now it turns out all of the other candidates saying what we said 4 years ago.
Bernie Sanders campaigning in New Hampshire on Saturday. He joins us live from New Hampshire this morning. Senator Sanders, thanks for joining us this morning. Let's dive into one of those ideas right away. You just heard Julian Castro and Nate Silver on this idea of Medicare for All. They say it's a popular program, but want to pick up on that Kaiser poll that Nate just mentioned. When you talk about eliminating private health insurance, support flips, you get 58% opposed. It gets even worse when you tell Americans they're going to have to pay more taxes, which you have conceded. Look at that right there. It goes to 37% favor, 60% opposed. So it appears you're pushing something people say they don't want.
No, we're taking on the pharmaceutical industry, which charges us the highest prices in the world for prescription drugs while they make tens of billions of dollars in profit. We are going to lower prescription drug costs in this country by 50%. We're taking on the insurance company, also making massive profits. Now, if you tell the American people what Medicare for All really is, and that is for the elderly, we're going to expand benefits to include dental care, hearing aids, and eyeglasses, your numbers are going to go up. And most importantly, when you tell the American people and small businesses that they are no longer going to have to pay any premiums, any deductibles, any co-payments, and that for the overwhelming majority of people, health care will be much less expensive under Medicare for All. And by the way, Medicare today is the most popular health insurance program in the country. Private health insurance is not particularly popular. And when you tell people all of that, then your numbers go up. Bottom line here, George, is the United States must end the international embarrassment of being the only major country on earth not to guarantee health care to all people as a right. We have some 80 million people in this country who are uninsured or underinsured, can't afford to go to the doctor without duress. We're spending twice as much per capita as the people of any other nation.
But as you know,
that's absurd.
For a lot of Democrats, the question is how you get there. And it is true. You tell people you're going to raise their taxes, support goes down. You tell people they can't have private health insurance, support goes down. And that's led some of your opponents to say, yeah, how about Medicare for everyone who wants it? And if it works, if this public option works, then the private health insurance are going to wither away anyway.
Well, two things. All right. Again, it's not a question of paying more taxes or not. It's a question of not paying any premiums. If I said to you, George, let's say you're self-employed and you're spending $15,000 or $20,000 a year out-of-pocket expenses, premiums, and so forth, and I said, George, you're going to pay $7,000, $8,000 more in taxes, but you're not going to have to pay your premiums. You're probably going to say, where can I sign up? People are going to spend less.
I'll tell you what I might say, Senator. I might say, Senator, those taxes are going to be certain. Those taxes are coming no matter what, with the hope that your program is going to work.
Well, you don't have the taxes unless you have the program. So the bottom line here is we have a dysfunctional health care system. The overwhelming majority of the American people are sick and tired of getting ripped off by the pharmaceutical industry. And let me say it again. We are going to take on the drug companies. We're going to lower prescription drug costs in this country by 50%. And every American, whether you're rich or you're poor, is entitled to health care as a human right. Look, at the end of the day, life expectancy in the United States today is actually in decline. You have huge areas of America, county after county, where people don't even have a doctor. So we need broad changes in our healthcare system. You talk about a public option. Many people will not be able to afford a public option. What the American people have got to decide is one simple question, George. Do we create a healthcare system guaranteeing healthcare to all people without insurance companies and drug companies making huge profits and distorting healthcare in America? That is the issue, and I think the American people will stand with me on that issue.
The debate's going to continue over the course of this campaign. Also want to get you to weigh in on President Trump in walking into North Korea this morning. In the past weeks, you've actually praised his engagement with Kim Jong-un, but we just heard Julian Castro say that what he's doing is growing the strength of a dictator.
Well, the concern here is his incredible inconsistencies. I have no problem with him sitting down with Kim Jong-un in North Korea or any place else. But I don't want it simply to be a photo opportunity. The whole world's media was attracted there. What's going to happen tomorrow and the next day? He has weakened the State Department. If we're going to bring peace to this world, we need a strong State Department. We need to move forward diplomatically, not just do photo opportunities. And right now, while he is, meeting with Kim Jong-un, he is still provocative in terms of almost moving toward a war with Iran. He vetoed legislation that I supported and that we won in the Senate and won in the House, which would get the United States out of the horrific war in Yemen, which is led by the brutal dictator, Mohammed bin Salman of Saudi Arabia. So I don't have a problem with him sitting down and negotiating with our adversaries. I just don't want it to be a photo opportunity. We need real diplomacy.
So you don't buy the argument that this is growing Kim Jong-un's strength, legitimizing his nuclear program and basically letting him off the hook on human rights?
Look, there are different ways to go forward, but I think sitting down with our adversaries is not a bad idea. I wish he would do that in the Middle East as well and in the Persian Gulf. I wish he would sit down with a dictatorship in Saudi Arabia, bring Iran into the discussion, and tell those people that we are sick and tired of spending trillions of dollars because they keep going to war against each other. Bring them into a table. Let's work out some lasting peace in the region. I don't have a problem with that. But on the other hand, we also know that you have a president who seems to love authoritarian people, whether it's Mohammed bin Salman in Saudi Arabia, whether it's Kim Jong-un. You don't have to say positive things about brutal dictators. You should sit down and negotiate with them. In the case of North Korea, if we can get rid of nuclear weapons there and their missile system, which is a threat to Europe and to the United States, that would be a very good thing.
I want to pick up on an issue that came up in Thursday night's debate. It was between Kamala Harris and Joe Biden, her raising his opposition, his opposition to busing back in the 1970s. I want to bring the debate forward. You've mentioned that you're concerned about the idea of resegregation of our schools. Does that mean that busing should be on the table today?
Well, I think resegregation is a very, very serious problem, and the federal government has failed in fighting for fair housing legislation. We need basically in this country well-funded public schools. We need to honor our teachers, respect teachers, make sure that they're earning a living wage. We need to take care of those schools today which have a lot of kids who are in some cases actually hungry, coming from troubled families. We need to build public education in this country. We need to make sure that kids go to community schools which are integrated. And that means we have to focus on fair housing, legislation, and enforcement.
But does that also mean busing? Because your website actually says that you're coming out for repealing of the ban on funding for busing.
No, busing is certainly an option that is necessary in certain cases, but it is not the optimal. Does anybody think it's a good idea to put a kid on a bus, travel an hour to another school, into another neighborhood that he or she doesn't know? That's not the optimal. What is the optimal is to have great community schools which are integrated. That's what I think most people want to see. That's what I want to see.
Senator Bernie Sanders, thanks for your time this morning.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.